Alrighty, we are live again this week with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you for joining us again, Doctor.
Hi again.
So my name is Dilshad Burman. I'm a web writer with CityNews and 680 News, and I'll be moderating this chat today. We have had a ton of questions again for the doctor this week. She has been kind enough to join us every week for several weeks now, answering all of your questions. So let's dive in right away, Doctor.
Okay.
Alrighty. So the first one is about stage 1 and stage 2. Toronto is still being kept in stage 1 so far. Is there a particular milestone we're looking to hit before we can enter stage 2 of reopening? Like, is it a number of cases or is it the transmission rate? What are we looking for before Toronto can be given the green light?
So there are a number of indicators, we call them, that we're looking at to see when Toronto will be ready. You can see more municipalities are going out this week. Durham, York, our neighbors are, but Toronto, Peel, and Windsor are still going to be in phase 1. A lot of it has to do with the activity of the virus. We still have a number of cases. Our rate, meaning the number of cases we have per population, is still higher than other parts of the province. And we want to be able to see that those are really coming down, that our 7-day average shows that they're declining to feel more comfortable in opening. That being said, it's also a decision of the provincial government as well. And so hopefully, we are certainly hopeful that we are in the right direction and that Toronto will reach that stage shortly.
Are we looking at 1 week, 2 weeks? Do you have any guesses?
So the province will be reviewing the data a few times in the week. And so you might expect on Monday, typically that's when the announcements come out. And so we could see then.
Okay. So lots of questions about the virus itself this week once again. Lydia is asking, how much does heat or temperature play a role in killing the virus? For instance, if you wash your hands with very hot water, would you still need to do it for 20 seconds?
Yes, you still need to do it for 20 seconds. It's actually beneficial to wash your hands with warmer water because then you're more likely to keep your hands in the water for longer. That's why we actually discourage washing your hands with cold water, because then it's too cold for your hands. You're in and out washing the hands. So the idea of the length of time for washing your hands is that you can get that lather when you scrub the soap and you actually really rub the, whatever's on your hands off. And that's why we're recommending the 15 seconds to lather. That's the important part.
Okay. So then Paul asks, I guess it's kind of a follow-up almost, why are we told that soap is more important than temperature of the water when washing our hands, but when we wash reusable masks, we're told to use hot water?
That's a good question. Again, when you're washing your hands, you can't quite, when you wash your hands with cold water, again, it's that lather that you want. You want the soap to really get into your hands, and you cannot really tolerate washing your hands that well in cold water. When you're washing clothes, the hot water and especially the dryer can actually help to get rid of any residual virus. And so in a piece like a cloth, you don't have your hands to rub together, and you're not sure you're going to get that kind of agitation in a washing machine. And so that's why taking extra measures like using warm water and then also using the dryer is recommended.
Okay. Somebody just asked us a question coming in live here from Catherine. What is the difference between stage 2 and stage 3?
Well, no place in Ontario has hit stage 3. Essentially, it's different phases for the amount of activity that we have that's spreading in our community. And so in stage 3, we might expect to see more larger gatherings. Gyms might open up in stage 3. So there are a number of different things that will open up further in stage 3. But to get to stage 3, we have to continue to see that the virus is under very good control across the province.
Right, of course. And coming back to the virus, then Sam asks, does repeated use of hand sanitizer lead to some bacteria becoming resistant to it?
So in this case, we're using hand sanitizer for coronavirus. It also does work against other viruses and bacteria. There's no evidence that the hand sanitizer itself causes bacterial resistance. It's an alcohol-based product. Where you worry about resistance is if you have an antibacterial type product. So those antibacterial soaps, you can get resistance to those, but the alcohol-based hand sanitizer, there's been no evidence for resistance that I'm aware of.
Okay. Oh, this is an interesting one. It is said that the COVID-19 virus is active, not alive, and that it requires a host, but we can kill the virus with soap and disinfectants, etc. So can you explain the difference between active and alive?
Sure. So what it means is that if the virus is, say, on my hands and I get it into my body, if it's still active or alive, I mean, they mean pretty much the same thing. It means that it's not dead, and if it goes into my body being the host, it will replicate. And so that's the difference there, that it's only actually active once it's in my body and replicating or infecting me. But when it's on surfaces, it can be active there, it can be present there. And we don't always know if when it's on a surface, whether that's dead or alive.
Okay.
So it's confusing.
It is, yeah. So basically, in order for it to replicate and grow, it has to be inside your body.
That's right. And that's the part where it needs a host. It needs your body to replicate. Yeah.
Right. Okay. Okay. Nick is asking more about the things we're allowed to do now in stage 1. He says, I'm confused regarding the new social circle initiative. Could you please explain it in further detail?
Good question. Yes, it's good to get this under control. So we have gatherings of 10 that are allowed. And that means that you can be in a group of 10 people, but you have to keep that physical distance between everyone in that group of 10. Mm-hmm. A social circle is what other provinces have called the bubble. But usually when they refer to the bubble, they talk about yourself with maybe another household. Here, it's a bit more broadened, but essentially you take your household, the number of people in your household, and you add to your household or social circle, as we're calling it, and those 10 people can stay together. They don't need to physically distance. In your social circle, you can hug and you can babysit and do all of those things. But you have to recognize that if one person in that social circle of 10 gets COVID, everyone is considered a close contact because you're not maintaining that physical distance. And the idea behind the social circle is that you stay true to it. You're in one social circle and only one.
And that's a tough one because people have so many different social circles in life. That, I think, for me personally, has been the toughest thing, because how do I force everybody to get into my circle and stay there?
Yeah, and so I think what you should plan is, who are you going to be closest to? Who are you going to spend the most time with? Who are you confident that they're also going to take the same measures as you to not get you sick as well? And if you want to see the others in your broader circle, you can see them. You just have to keep that distance.
Right, of course, yeah. Another one coming in right now live, Elsa asks from Hamilton, I'm wondering if we have a chance to avoid a second wave now that this first wave is lasting longer and we're taking a little longer to reopen, we're taking more precautions.
So we are certainly being methodical. We're going slowly. We're making sure that our numbers are down. And I think it's a good thing so that we're actually prepared. The more that we have a virus circulating and we move into that next stage too quickly, we can see what's happened in some places, even in the United States, where then there's too much virus that's around. Now you're mingling more in society, and then that virus just multiplies. And so that's the point. That's why we want to go a bit slower going into phase 2, so that we can continue to slow the spread. That's the goal here. Right.
So, and in that sense, then by extrapolation, would we sort of avoid a massive second wave if we were to do all of that?
That's what we're trying to do. That's exactly what we're trying to do. So we're still trying to continue to flatten the curve. We're down, and now we want to stay down for as long as we can. That's right.
Right. Okay. So this is a question about testing. We had heard the premier or one of the officials say that at-home testing might be possible for those who are disabled and older. So Maxwell asks, as a senior that's disabled and housebound, can I get a swab test done at home?
In Toronto, right now, we don't have a mechanism in place. There are some places in the province who have, for example, people going in and can do tests. I think, and so that may be coming across the province. I think we have to realize why are we testing someone who's in a home? If they've been in contact, for example, if they have a personal support worker who comes and looks after them,
yes,
and that person was sick, then testing that person who's in the home is really important. But if you actually are homebound and don't actually leave, don't have contact with a lot of other people, the necessity to test you at home is actually less. And so we have to think about all of those kinds of things. What's the risk right now for someone who's at home who needs to be tested?
Okay, and so currently that's not happening, and there's going to be sort of an assessment of whether or not that should happen.
So as you can see that, Toronto Public Health is not the lead for testing, but we work with Ontario Health, who is the lead. Right. But they are certainly developing mobile testing centers. And so sometimes if someone can't leave the house, so if there's a mobile testing center outside their building, they might be able to access that more easily than, say, going to a hospital. So we are seeing more movement there in being able to make the testing more available across the city.
Right, okay. Lot more questions about how someone catches this. People are still very concerned. Harley asks, do fans circulating air in an enclosed room spread the virus?
It's very unlikely. It is a theoretical risk that if the virus is alive, or active on surfaces, and then the fan is blowing it in the air, that you could get it. In fact, it's one of the reasons why we put out guidelines for hairdressers. They will be opening eventually in Toronto. And we said, can you blow dry your hair in those centers? And we said, because of this theoretical risk, you have to be wearing a mask as the hairdresser, the hairstylist, and the person who's getting the haircut has to, and anyone else who's in the environment has to wear it, because it is theoretically possible. That being said, if the fan is blowing away from people, it's blowing into the ceiling or to the wall, the risks really are very, very low. And if it's a heat day and you don't have air conditioning and you're relying on the fan to cool you down, by all means, please do turn the fan on.
Okay, that's really good to know. And the thing about hairstylists as well, you have to blow dry your hair. You're not going to get a haircut without it. So that's really good to know. Okay, so let's move on to Mohammed. Mohammed asks, what is the percentage of chances to get COVID-19 from groceries?
From the actual groceries, eating the food, very, very minimal. It has not been shown to be spread through food. But on the surfaces that you pick up, do you need to wipe down your groceries? We're not recommending that. It's very unlikely to be present on those surfaces and to actually be able to infect you on those surfaces. But when you come back from grocery shopping, when you leave the store, make sure you wash your hands, use hand sanitizer. When you put your groceries down on a counter, make sure you clean that as well. If you have any bags, throw them in reusable bags, throw them in the wash. But again, if you think about things like the paper bags or packaging that maybe the virus does not live on those surfaces for very long.
Okay, that's good to know. Let's see. Anne asks, what is the source of the infections? Like, has anyone caught it from shopping or being a cashier? Because we've been talking about community spread, but you've made a distinction earlier between close contact and community spread. So has anybody caught it in these kind of, open situations? What are the chances basically of getting it from somebody you're not close contact with?
It's a really good question. And I think the bottom line is, if you have contact with other people, especially less than 6 feet, you should be prepared that you could get COVID. That's our bottom line message. We still do have community spread. We know in our cases, our most recent cases in the past 2 weeks, 55% of people are getting COVID from someone who they knew who had it. So someone who they were close contact with and had COVID, 65% are getting it that way.
Wow.
But we still have about 25% of people who we say are getting it in the community. We can't quite pinpoint where they got it. I mean, we have to go back 14 days to see what kind of things you did. And so sometimes it can be difficult to say, well, you got it, for example, at this grocery store.
Right.
But I think that's why when you're out in public, when you're out meeting with people, when you're doing activities, you need to keep that distance, wear a mask, wash your hands, don't go when you're sick, because 25% of our cases are getting it in community settings where we can't necessarily identify, well, you were in touch with this person who had it.
And 25% is a very large percentage of people. That's no small number for sure. That's a quarter of the people that are getting it from community spread. So that's still very concerning.
Yeah, and what it means is that you may have been in touch with someone and you were not aware that they had it, and you might have been close to them. And so that's why we all have to take the precautions. Yeah,
definitely. Yeah. Chris is asking, now that religious places of worship are open, he says, is going to church or other religious gatherings with singing actually safe? He's citing a case in Seattle, a choir practice where people were physically distant, but still people got infected because of the singing.
Oh, yes, it's a really good question. In fact, singing is actually a very high-risk activity. And, I'm actually equally surprised that we can say if you sing, you can actually spread this virus more easily than doing a lot of other different activities. And so we've actually released guidelines for places of worship. And in it, we're very clear that there should be no singing, no chanting, no loud speaking. If there is to be a singing, it should be one soloist on stage, 4 meters back, like well distance with the screen in front of them. Singing is very high risk. And so we are not recommending singing in these places of worship.
Wow, that's news to me, honestly, and I work in the news. But so no karaoke bars, no loud singing with your friends, none of that.
And to the earlier person's question, that stuff may come in phase 3,
right.
But we have to be very certain that we don't have virus around, because those are what we would call higher risk or riskier activities for spreading the virus.
Right, absolutely. So that's going to be a very different church service, a very different experience of worship for a lot of people. Wow.
Yeah, and that's why we are still telling, while you can open places of worship, we are still saying that, if you can have virtual or online services, that's still a really, really good option.
Yes, absolutely. I think overall, one of the things that we've been hearing a lot about these guidelines is if you can do it in a safer way, please continue to do it in a safer way.
Yeah.
Okay. So this one we've had before, but worth re-mentioning. Ali asks, I live in a house in a busy residential neighborhood. Is it safe to open our windows to allow fresh air, or is there a risk of getting COVID?
Fresh air is a very good thing, actually. So it's good to open your windows. If you have others who you're sharing a space with indoors, opening the windows to get ventilation and fresh air is a very good thing. Mm-hmm. It's one of the reasons why we actually say that outdoor activities are actually safer than indoor activities. So yes, from a COVID perspective, opening your windows is a good idea.
So to that point, then we have another question very similar. Why are only patios allowed to open? Can't you safely social distance inside a restaurant as well?
Yeah, so we're in phase 2 right now, and we're kind of taking baby steps to get there. And so one of the baby steps is outdoor patio spaces, because the outdoor spaces are still safer. Mm-hmm. Indoor spaces still have higher risk. Sometimes you can't always physically distance when you're indoors. Yes. And that exchange of air or influence of crowding, someone who's sick who may not know they're sick and may spread it, those risks are higher. And so that's why we're moving to patios only. It'll also give us restaurants a chance to be able to start implementing these new measures and to see what it's like, keeping tables apart, servers serving food in a safe way. Mm-hmm. So it'll be a good way to ease into when we get into phase 3 and when indoor dining will be allowed.
Okay, yes, that makes sense. Because even currently, a lot of patios are, especially in Toronto, are very small and very close quarters. So even that feels unsafe at this point.
Yeah, and so when patios reopen, they will have to be able to maintain that 6 feet distance between tables. And if you go to these, you need to be careful about who you're going with, because when you're sitting at a table, you should really be going with your social circle, because you won't be able to maintain that 6 feet distance at the table with the people who you go with.
Right, absolutely, exactly. So more about testing and all sorts of other sort of virus-related things, because that's what we're talking about. Kathy asks, why do hospitals not perform temperature checks for visitors, but it is being implemented by airlines, daycares, and other businesses?
It's a good question. So in general, when we're opening up businesses and all kinds of things, we're recommending screening. That's the word we use to say, do you have symptoms of COVID? If you do, stay home. And so we're telling even customers who come into a store to make sure they don't have symptoms. Using a temperature as a form of screening is not always effective, because not everyone with COVID has a temperature.
Right.
Some studies have showed up, as low as 44% to as high as 90% of people have had temperature who have had COVID. You can also, take medication to lower your temperature, and so the reading won't be correct. You also have to think about the people who are doing the temperature, and they will be closer contact with you. And that then creates another risk, because if you have it, you could spread it to them. If they have it, they could spread it to you. And it is not always present. And so that's why, I think on places like planes where you're going to be enclosed for a longer period of time, taking those extra precautions are why they have temperature checks, same within a childcare center. But in other places, if you're going to wear a mask anyways, and you're going to have screening questions in general, that is probably just as good.
Okay. And then another question about temperature. Chad asks, how accurate are temperature checks using IR thermometers? Are the thermometers inspected like certifying scales? Could an activity like running to catch your flight on time, cause your temperature to spike and therefore it appears higher?
So the reason why we do temperatures is you actually want to see what's your internal body temperature. And so if your skin is hot and you check the temperature of your skin, it can falsely tell you that you have a fever when you don't. It just means that your skin is hot. So that's another reason why temperature checks are actually not always recommended or even that accurate, because depending upon the type of thermometer you're using, like the infrared ones that just check the temperature of your skin, you actually can get incorrect results.
Right, and some of us just run hot. So some of us just run hot.
But your internal body temperature is not hot, because that's really a temperature is really having an internal body temperature above 38 degrees Celsius.
Okay. Coming back to masks, lots of mask questions. Wings asks, should cyclists and joggers wear a mask when working out in public? Are they expelling those droplets when they're breathing heavily, especially along public paths where physical distancing is not even possible?
So exercising is, again, one of those things that, you can expel droplets more easily, which is why gyms, you'll see, are not opening in phase 2. They are certainly a phase 3 thing to open. When you're exercising outdoors, the people that you're directly beside, so cyclists who are cycling in big groups, that it's more risky for those cyclists together who are side by side that they could share their droplets, especially because they're side by side for a longer period of time. But if you're actually just sidestepping someone, passing someone on on a trail or on the street, the risk is actually very low that a droplet from someone who's exercising could be spread to you. And so we're just asking everyone to really courteously sidestep people, to give people space as much as possible, because the risks there are quite low.
Okay. And then a follow-up question to that, should you wear a mask when you're exercising outside? They say that it's quite hot now and they find themselves sweating under the mask. So is that like mask environment conducive to the growth of germs in that sweaty sort of area?
It would be extremely difficult to exercise properly wearing a mask. It could also be dangerous because you're so hot. And as you said, once the mask gets wet, you're actually recommended to change the mask. So the more important thing is that you exercise in a place where you can exercise safely, where you can keep a 6 feet distance from others so that your germs are not being spread to others and so that you don't need to wear a mask.
So if you're going running, say, or if you go for a brisk walk or something, it's recommended not to wear a mask then?
In those situations, you really don't need to wear a mask. Mask is really when you cannot maintain that physical distance.
Mm-hmm.
And it's actually even more important in indoor settings. But again, if you're going for a walk and you're walking beside someone, well, you can spread it to that person beside you because, especially if you're walking for more than 15 minutes.
Mm-hmm.
But if you're actually just passing someone on the street, you don't need to wear a mask to be able to protect other people that way. The risk is very low.
Okay. More mask questions. Ahmed asks, is it safe to drive a taxi when you have a mask on? Can you get the virus while still covering your face?
The mask actually helps to protect your germs from staying to yourself. If
Yes.
you're a taxi driver, you can ask that. First, you can ask the people that are coming into your taxi, do they have no symptoms?
Mm-hmm.
And secondly, you can ask them to wear a mask as well, to sit in the back seat, to keep the windows down. Some taxi cars are actually also putting up that plexiglass barrier, which will also be helpful to protect the taxi driver.
Yes. Okay. One more mask question. Again, we've had this before, but good to reiterate. Is a face shield as good as a mask? Are they, interchangeable?
No, they're not interchangeable. They work very differently. A mask protects and keeps your germs from your nose and your mouth to yourself. The virus is spread through respiratory droplets that come from your nose and your mouth. And so when you keep a mask, you keep those germs to yourself. When you wear a face shield, there may be some protection from your droplets on your face, but certainly it's not full protection. And the idea of a face shield is more to protect your eyes, so that if someone's coughing, you don't get it in your eyes. And so really, the utility of a face shield in a public setting would be very low. It would be more recommended and more beneficial that you wear a mask.
Okay, yes, I needed that reiterated because we've had this question a couple of times, and I remember you saying it's not the same thing.
That's right.
This is an interesting one. This one actually comes from my fellow web writer, John. John asks, if the virus is present on your hands and you touch your eyes, nose, and mouth, you can infect yourself. But what if there is a cut on your hand, like a open cut? Can you get infected that way?
There's no evidence right now that the virus can come in through your blood system that way. So, unlike other viruses that can spread that way, into cuts or wounds, COVID does not seem to be spread that way, no.
Okay. Oh, that's good to know. That's really good to know.
And that's why wearing gloves is not necessary, because if you wash your hands afterwards, you'll be able to remove the virus, and you don't have to worry about the virus going in through your skin.
Okay. That's one less thing to worry about, at least. Solomon asks, are people on the 14 days of quarantine allowed to exercise outdoors? Can they go by themselves, like alone, for a walk or a run?
If you're in 14 days of quarantine, or we call it self-isolation, you are to stay inside your house. You can go in an enclosed porch or patio or into a backyard, but you're not to go out for a walk or a run if you are in the 14-day isolation.
Right, that's why it's called isolation. Another question about how it's spread, I think. Should you avoid sharing food?
Yes. So, sharing spoons, touching the same spoon, all of those things can contribute to spreading the virus, which is why things like buffets are not recommended, which is why you'll see some places are recommending don't have potlucks when they're having large gatherings. Single service food items. So, if you're sharing foods, have everything all packaged so that people can take it themselves rather than handling the same instruments or using the same utensils.
Right. That makes sense. Okay, and we still have a little more time. Okay, William asks, can a person get infected from people who are administering the tests? He says, I see them passing papers to people in their cars, and then they lean in to do the test. And it seems like they might be able to spread it because they're using the same equipment and gowns the entire time. They don't change between, in those drive-through centers, they don't change between cars.
So the biggest risk is that they wear a mask because when they get close to you, you don't want their germs coming onto you. Their gowns should not be touching you. And after, you leave that place, you should wash your hands. If you're worried that, their gown may have touched your clothes, you can wash your clothes afterwards as routine. You can clean the inside of your car if you're worried about that. Again, the risks of spreading it that way would be quite low.
Okay, good to know. Because everybody's, I think the drive-in centers are quite popular right now, and they've been quite inundated with people going in and out. So that's good to know. Dylan asks, my partner was recently tested after having a persistent cough. The nurse administering the test informed him that up to 30% of the tests are showing a false negative and to quarantine for 14 days anyway. Is this across the province, or should we be concerned about testing reliability?
The test is actually very reliable. So if you get a negative test, there's a couple of things you have to think about. One is, do you have symptoms? If you have symptoms and you tested negative, you have to stay in isolation until your symptoms resolve. And if your symptoms get worse, then you need to consider getting tested again. That could be a false negative. But if you have no symptoms and you get tested, that negative test on that day is very, very accurate. But if you get symptoms a few days later, or you test positive a few days later, it could be that you're later on in your infection, and that's why the test is being picked up later on. It's not, from a medical term, we don't quite call that a false negative, so some people may interpret it that way. But if you have symptoms of a cold, you get tested, you're negative, your symptoms stop, 24 hours after that, you can actually go back out and don't need to be in that quarantine for 14 days. Unless you've been exposed to someone, you were close contact of someone who had the infection, then even if you test negative, you need to stay in for those 14 days, because in that situation, that negative test could be negative on that day, but you could still develop the symptoms on day 10 or 14.
Right. And because like you said, the incubation period is 14 days. So you need to be careful for that entire time.
That's right.
Okay, so we're just out of time, but there's one last question I'll try and squeeze in. Doug is asking, how many strains are there of COVID-19? Do we know?
Right now, it seems that there's just the one strain, the main strain that's circulating. It doesn't seem that it's mutated or that we have other strains, because this is part of the question that if there's more than one strain, can you be infected again? And so as far as I know right now, based on the evidence, there is only the one type that's circulating. Okay,
again, one less thing to worry about for now, at least. And so in that sense, if a vaccine is developed, at least for this one strain, it should be effective for everybody.
It should be, yes, that's the goal.
Okay, well, on that hopefully positive note, I'll wrap this up today. Thank you so much again, Doctor, and we'll see you next week.
Yeah, we'll see you next week. Thanks.
Okay. Thank you. Bye-bye.